First, I want to thank everyone for being here. This is a very important event and a step that we're taking, bringing transit back in the Bay Area. My name is Jim Sperry. I'm a Solano County Supervisor. I serve on MTC and I chair the Blue Ribbon Transit Recovery Task Force. And that committee has taken on 3 tasks. One is to get the federal CARES allocation out quickly and equitably, and we made that recommendation to MTC's commission, and that was done on July 22nd. The next task that the committee has taken on is the transit recovery, and that's why we're here today. This is one step in that recovery strategy. And the third issue that the task force is going to take on is we're going to look at both the operations and organizations of the Bay Area Transit, working with MTC and the legislature, and making recommendations working with the transit operators. What brings us together today, this is a health, economic, and transportation crisis. It's something that many of us have never seen and have experienced, and so the learning curve is very steep, and you're going to hear from several of the transit operators what they're doing to deal with this crisis that we're facing with this coronavirus. And what's going to happen as this Bay Area recovery, in part, transportation on how it recovers is really going to be part of how the whole Bay Area recovers. Transportation plays a very important role. The Bay Area recovery and transit is going to be dependent on an efficient, effective, and healthy transit network. A network that protects our employees, transit employees, and protects the riders, and one that people can have confidence that if they are going to ride public transit, it's going to be a health and safe journey for them. You know, if for the county, I come from Solano County, if you're to get on a bus in Solano and take it to Bart or AC Transit or Muni, you want to be sure that that trip is going to be safe, and it's going to have the health and safety protocols and standards in place that you can count on it. And that is what you're going to hear about today. And this really is historic that the transit operators have all come together, the small, medium, and large, to really address this very important issue that's important to transit riders. Today, as we launch the Riding Together Healthy Transit Plan, it's a first step on a long journey to build the public confidence in transit. Not going to be easy, but I'm confident that the Bay Area is up to this challenge. We're not going back to public transit as normal. What we are going to see is the future of public transit. It is going to change, I think, forever. And there's several speakers that are going to talk about some of those changes that are taking place. At this time, I'd like to introduce the general manager of Bart, Bob Powers, but before Bob comes up, I really want to thank Bob and all of the general managers of all the transit operators, from the small, medium to large. You know, they have stepped up, and the work that they've done, and you're going to see that revealed today, it really is unprecedented, the work and the plan that they're bringing forward. I just want to remind everyone, this is one step in bringing transit back and how we're going to provide these services to the public. And so with that, I'd like to introduce the general manager of Bart, Bob Powers. Bob.
Hi, good afternoon. My name is Bob Powers, and I'm the general manager at Bart. So just a couple things before I get started. One, I wanted to just thank Chair Sparing. He is leading the Blue Ribbon Task Force that he mentioned here, but his leadership and his vision really were instrumental in helping the operators that you see here today, both large and small, throughout the Bay Area, get to this point. And as he said, this is the beginning of a very adaptive and a very much of a plan that can be monitored and reported back to the riders and to the public. So thank you, Chairperson Sparing. Secondly, I wanted to thank all the operators that are standing, both the ones that are standing behind me today for this event, the smaller operators that couldn't be here, the operators throughout California and the nation that are providing mobility right now, daily, to folks throughout the country. So I just wanted to thank them. Look, So the operators you have seen today here, we are all joining forces. We've done the research, we've studied international efforts, and we have reimagined what transit service can and will be. We are here to tell you that we are renewed and we are ready. Let me just say that one more time. We are renewed and we are ready. We may be separate agencies, but we share a common ground on two fronts. One, all of us are in a fight for our lives with funding as we move forward. So that's number one. And number two is we are all unified on this plan to get transit back on its feet in the Bay Area and to be national leaders in that discussion moving forward. As the commissioner outlined earlier, we are launching our plan today with commitments to our riders and to our employees. But the plan also calls on our riders to play a key role. We cannot be successful, none of us can be successful without a new partnership, a new social contract with our riders. So public health officials agree on the following 3 points as it relates to COVID, right? 1, that wearing a mask. 2, social distancing. And 3, good hand hygiene prevents and limits the spread of COVID-19. That's the science of it. This plan sets out the expectations that customers, all customers, independent of systems, must wear a mask and remain at a minimum of 3 feet and optimally 6 feet apart. Each one of our systems that is out there running right now puts out enough service to provide for this minimum spacing of 3-foot social distancing. There are multiple European transport agencies that have proven that the 3-foot metric, when coupled with face mask and cleaning, is very safe. I rode on the train to get here today. People are managing social distancing in the transit environment. I go out in the system weekly. I'm out there looking at the riders, and we are social distancing out there. The number of trains that Bart puts out is based on data. We get what they're called heat maps. The data comes in, and if we need to put out more service based on social distancing, that's what we're doing, as are some of the other operators here. So the second part of my talk here is about hand sanitizer and hand hygiene. Each one of our systems has made a commitment about the importance of hand sanitizer. So Bart has hand sanitizer at every one of our 48 stations. I myself do frequent checks, spot checks to make sure they're filled. I came in through Embarcadero today and saw that it was filled. And we've added additional sanitizers at the larger downtown stations and downtown Oakland stations. And we are also asking our customers to take advantage of those hand sanitizers, but also to wash their hands before and after transit use. So those are the 2 points that I wanted to touch on, the hand sanitizer and the social distancing. Now let me turn it over to Mike Hirsch. Many of you know Mike. Mike is the general manager for AC Transit.
Well, good afternoon. I want to first thank Javier Jimenez. Just one example of the courageous frontline workers that are putting out public transit today. I think the bus operators, rail operators, the service workers, the car cleaners, the janitors have been overlooked during these times of essential workers. And I, as a general manager of AC Transit, want to recognize our frontline employees, all of them. Speaking for AC Transit, we are still carrying between 50 and 65,000 people a day. Now that's down from 180,000, but that's 65,000 people that have essential trips that have to happen on public transit. They are transit dependent. Without all of the operators you see here today, people's lives are greatly impacted, gravely impacted for some public transit riders. And I'm here to tell you today that working together, we've come up with a plan, and public transit is safe. Public transit is clean. just to put the numbers in perspective, our ridership's down 56%. We are also not able to collect fares right now because we have rear door boarding. That's a safety measure both for the passengers and for the operators so that there's not congregation, a line, if you will, a queue boarding the front of the bus. We have purchased the materials to put plexiglass barriers up so that we can resume fare collection later this year. Our primary number one directive is safety of the operator and safety of the passenger. The bus behind you has the barrier up. You're happy to look at that a little bit later today. The other agencies who joined me today realized one fact. The customers were leaving because they were in part afraid to ride on public transit. That uncertainty is our call to action, and it's why we're here today. We've prioritized cleaning and disinfecting. We've modified service. For AC Transit, we had to cut back to weekend levels of service. We've implemented social distancing on the buses. That at times does create pass-ups. We're sorry for that, but we've added back some service last Sunday. We will continue, as Bob Powers spoke. We also are monitoring our daily ridership, talking with our operators and figuring out how to put out the most effective service, again, so essential riders, people with essential trips, can get to their destination. We are communicating as loud and clear as we can. You can help with that today. Thank you for being here. Help us spread the message about the importance of wearing a mask. Our bus operators are not law enforcement. They have an incredibly difficult job. We need the public, we need transit riders to rally and wear a mask, please. We have prioritized the disinfecting across janitorial staff in our facilities. We always had the buses line up at night for cleaning on our fuel islands. They get swept, trash removed, washed, but we've added a new step. We're now using antiviral vapor fogging. We have that product available to demonstrate here today if you would like to see. Every bus is fogged every night. It's a EPA approved harmless chemical that as it deteriorates, it turns into simple salt, but it's found incredibly effective in eliminating the COVID-19 virus. Vital oxide does not, the material does not require PPE, mixing, or wiping. And to put this into perspective, we spent $2.5 million immediately on PPE and cleaners. That's just AC Transit. You look at the number of buses around here today, we've all prioritized the PPE and cleaning. For AC Transit, we immediately bought 6 backpack sprayers, 4 handheld electrostatic sprayers, 20 foggers, and over 600 gallons of the cleaning fluid. That was our initial purchase. We continue to keep PPE and all the cleaning supplies on stock and purchased regularly. I will comment that on the operator barrier, there's a significant backlog or unavailability of plexiglass, and that's why we're delayed on resuming fare collection. Unlike train cars, the buses don't have a separate operator's compartment. That's why that operator barrier is so important for us. Again, I stress that our riders play a vital role in keeping essential service rolling. Remain home if you feel sick. Regularly use hand sanitizer and wash hands. We'll continue the rear boarding and onboard physical distancing. We look forward to being able to collect the fares because, as Mr. Powers said, we are desperately in need of financial funding. The future of public transit is dependent on ridership coming back and identification of other revenues so that we can continue to provide these vital services. The state of California is mandating face coverings. Again, I want to stress that we need you and the public's help in the face coverings. Please respect your bus operators, respect your transit employees, respect your station agents. They have a very difficult job. So what are our next steps? We continue to follow all CDC guidance as it evolves. We're taking advanced steps to protect the health of employees and keeping buses on the road. I mentioned the cleaning that we're doing not only on the buses but in our facilities. We are next month for AC Transit rolling out disinfecting buses at the end of the line on our heaviest ridership lines. Stay tuned for that. It's a difficult time, but together we can get through this. I'm proud to introduce a friend, a coworker, another transit leader, Executive Director of Caltrain and General Manager of Samtrans, Jim Hartnett. Thank you.
Thank you very much, Mike. I'd like to thank all the general managers and directors of our transit agencies from around the region who are standing together. And we do stand together, not just here today, but our presence here together is evidence of our cooperation and coordination on all matters related to health and safety. This health and safety plan has been discussed today in its various components. I won't repeat each of the items that have been mentioned, but I can tell you that as Executive Director of Caltrain and General Manager of Samtrans, we are joined together with our other transit agencies in implementing all the components of the Healthy Transit Plan that we're talking about today. Every element of that plan that has been discussed today is truly important. I'd like to second two things that have been said and emphasize them. First, the wearing of masks. We all know how important that is for our operators and for our customers. And we have had, all of us have had great success with our customers in maximum utilization of masks. It's so important to them and it's so important to our operators. Secondly, I'd like to add on to the praise of our transit workers, our frontline workers, and all those who support them. They are serving those who are truly dependent upon our public services. Without them, we could not provide the service that is so desperately needed by those who are on transit today and who are keeping us ready as more of our riders are able to come back to utilize our services. And we know that we have to preserve and sustain and expand our services in order to take care of our public mission and our customers' needs. We, as with AC Transit and others, have added recently additional service to provide even better and more service for our transit-dependent riders on the bus and paratransit system. And on our rail system, we're keeping up sufficient service for people to get where they need to go in a timely fashion and when they need to get there. But there are additional components to the Healthy Transit Plan that have been mentioned already, including the strategy we have implemented for the touchless utilization of our services. The Healthy Transit Plan includes touchless fare payments. Now, many of you are already familiar with the regional Clipper card that most of us have already utilized that. We are all doubling down on touchless fare payment, not only increasing the usage and availability of Clipper cards, but our mobile apps as well that are making it much easier to utilize our transit system in a touchless way that is a benefit to our riders as well as to our operators. Contactless and digital payment methods are really important as we are able to decrease the physical contact both for our customers and our operators. This is becoming even more available as many of us have increased the availability of our mobile apps for all the services that we provide. It's an important part of our strategy, and it's one that we have all been working on together. I can't emphasize enough the coordination and cooperation that each of the transit agencies in the region have embarked on. We meet regularly. In fact, since the pandemic, we probably meet at least weekly to talk about our healthy transit plan and other common elements of our service that are so important for us to cooperate on. And so with that, I'd like to introduce another very important part of our regional transit service to introduce to you Jeff Tumblin, the Director of Transportation for San Francisco MTA.
Hello, I am Jeff Tumblin with the SFMTA. Since the very beginning of the COVID crisis, we in San Francisco have been tracking the data and protocols from all of our international peers, particularly East Asian democracies, cities like Taipei, and Western European capitals from Paris to Vienna. And something that is clear in all of these places that have extensive COVID contact tracing, is that among our peers, there have been 0 cases of documented COVID transmission on public transit. Here at the SFMTA, we are finding the same thing. We do COVID contact tracing when there's a COVID positive case at our agency, and so far those cases have been random, and those cases have been less than the general population COVID transmission rates. That is to say, we still need to keep doing more, doing all of the health and safety protocols that my peers have just talked about at other agencies, but it seems that public transit is about as safe a place to be as anywhere. All that said, COVID has been devastating for all of our agencies. The health and economic impacts of COVID have forced SFMTA to cut over 30% of our service hours and have cut our available capacity as a result of social distancing by about 2/3. This is really hard. It is also the most important time for us to pay attention to equity. Equity is most important when you're needing to make really painful cuts in service. And so this has been a time where we've been forced to operationalize our Muni equity strategy. We've had to completely reinvent the entire Muni system twice since April. And in order to do that, we've had to pay very careful attention to the data of where essential workers are actually traveling. Fortunately, we have great data, and we track it on an hourly basis and make adjustments accordingly. We've had to completely rework the system because travel demand here to the financial district is way down, but it is up in our neighborhood commercial districts, in our essential institutions. And we've had to direct that service where it is most needed. We've had to direct more service to neighborhoods where residents have the fewest mobility choices and least access to local services in their neighborhoods. On key corridors like the Mission Street corridor or San Bruno Avenue or Bayshore or Stockton Street in Chinatown, Muni is delivering faster, more frequent, and more reliable service than it has in its history. This is because we are taking equity very, very seriously. We do not want our essential workers to be left behind at the curb. We want to make sure our essential workers can get to work because if you're an essential worker, not only can you not telecommute, you also are fired if you're late for your shift. Equity is something that we're all taking seriously in this time, given the reality of the health and financial crisis. And it's something that I'm actually proud that this agency has been able to do in spite of everything that has been thrown at it. And with that, I would like to introduce Dennis Mulligan of Golden Gate Transit. Thank you.
Thank you, Director Tumblin. My name is Dennis Mulligan. I'm the General Manager for the Golden Gate Bridge Highway and Transportation District. Great cities cannot reopen fully, and our bustling economy cannot return to its former greatness in the absence of full mobility, and that includes transit. So I'd like to echo the sentiments of my colleagues in thanking Chair Jim Spearing for his tremendous leadership, chairing the Blue Ribbon Transit Recovery Task Force. I'd like to thank all my colleagues running transit agencies here in the Bay Area and across the country as we struggle to help the country reopen. And I particularly want to thank the men and women of labor who are instrumental in mobility every day getting people to work. I'm going to talk a little bit about fresh air. Fresh air is essential for life, and we know today it's essential for safe travel in the COVID era. So Golden Gate Transit and Ferry, along with all of our regional partners here today, recognize the importance of air in fighting the pandemic and opening the region safely. So we're doing everything we can to provide fresh air to all of our customers, and we want to talk a little bit about that. Similar to being outside, frequent air replenishment indoors or on a bus or on a train or on a ferry boat is essential for safety. The plan that we're launching today includes several measures to keep the air you breathe while you're on our buses, boats, and ferries clean and fresh. All of us are doing everything we can to facilitate the replenishment of inside air with outside air. We're opening windows, we're firing up ventilation systems, we're using state-of-the-art filters where we can, and we're taking every step that we can. Some buses have windows that open, trains have doors that open and close frequently that push air in. A bus like that bus right there behind you replenishes the air every 2 minutes inside the bus with outside air. So it's important that our customers understand that, so that when they come back to transit, they know that we're doing everything we can to provide fresh air, and as long as they're doing their part, wearing masks, being safe, that we can all travel together, we can all reopen the economy, and we can restore our cities to greatness. Thank you. I'd now like to introduce Nuria Fernandez. She is the General Manager and CEO of VTA. Nuria.
Thank you very much, Dennis. I am Nuria Fernandez, General Manager, CEO of the Valley Transportation Authority, and I am delighted to be here, not only because I'm standing with my fellow general managers, those behind me and those in the audience, but because I'm joining my voice and my action to not only the things that they have said, but those things that we have all committed to do to preserve public transportation and ensure that both our customers and our drivers, operators, and everyone who touches our system is safe. The pandemic has been very difficult for all of us, but it is especially difficult for individuals with disabilities who depend on our services and they have limited options to get around. Over 25 million Americans experience a travel limiting disability that makes it difficult to participate in activities of daily living. And just a couple weeks ago, on July 26, 2020, we celebrated the 30th anniversary of the Americans with Disabilities Act, which opened the doors to equal access and opportunity for people with disabilities, because mobility is a civil right. It made it possible for them and the elderly in our communities to use our transit system as their access to medical care, to buy groceries, leisure, or for work. And in most instances, it's the only mobility choice that they have. There are over 100,000 paratransit subscribers in the 9-county Bay Area. That is almost 2% of the Bay Area's population. And we're talking about a vulnerable population. The majority are elderly and have pre-existing conditions, and they depend on our paratransit services for their medical appointments and treatment. Public transportation brings freedom, a freedom of mobility and access for all, particularly for those who depend on it. And that is why it's so critical to gain their confidence for all of those who rely on our service, that they know that we're keeping our passengers safe and our drivers safe. And recognizing this concern is pivotal to continuing providing that service. So how do we gain that confidence? By communicating to our paratransit vehicles all of the efforts that we've put in to make sure that they're cleaned, that we're doing thorough disinfecting and cleaning every day, and that the high-touch areas are cleaned in our paratransit vehicles after each trip. At the Valley Transportation Authority, we're currently limited to no more than 2 passengers on our cutaway buses and a single passenger in our minivans, and all because of the social distancing that's required for their safety. We have suspended all services on our Prius vehicles because there's not enough room for social distancing. But all of our paratransit drivers and our vehicle maintenance personnel have been provided with personal protective equipment in the form of masks and gloves and sanitizers and face shields. And each of our paratransit vehicles is equipped with hand sanitizers, and we provide medical masks for those subscribers or users that may require it and can medically use them. In addition to the full PPE for our drivers, we have installed a clear, durable bubble or barrier around the driver's seat in each of our minivans to physically separate the driver from the passengers. In fact, all of these actions are collected in our 10-point plan that was titled Strengthen Trust in Transit, as we provide our customers and operators with safe travel. And these actions, these points, very clearly connect with the region-wide Healthy Transit Plan that we're discussing here today, which deals directly in protecting the health of our passengers and operators, cleaning, sanitizing, requiring face coverings, distancing protocols, protecting our workers, just to name a few. And for all of these reasons, our customers, especially our paratransit customers, can rest assured we've got them. It is abundantly safe to keep using our vehicles. And in closing, I too want to extend my gratitude to the transit agency leaders in the Bay Area for coming together to speak and to act united. I am deeply thankful for the hard work of all of our transit operators and frontline workers, and our transit and our first responders and healthcare workers in our communities. Because of them, we can all stand here today safely. Thank you.